Hello dear listeners. My name is Darshinee. In this video, I will be discussing on the solutions to overcome the issues related to the health inequalities. We will get started with a short introduction on what is health inequalities. Then we will further the discussion to look at the solution that has been taken and can be taken to combat the issues on health inequity globally. According to the World Health Organization, health inequalities or inequity is defined as health inequities are avoidable inequalities in health between groups of people within countries and between countries. These inequities arise from inequalities within and between societies. Social and economic conditions, and their effects on people's lives determine their risk of illness, and the actions taken to prevent them becoming ill or treat illness, when it occurs. Let me tell you some examples of health inequities between countries. The infant mortality rate is 2 per 1,000 live births in Iceland, whereas, over 120 per 1,000 live births in Mozambique. This shows that there is a huge disparity in terms of health between these two countries. Poor health cannot be explained simply by germs and genes. It is much more complex, involving both the circumstances in which people live, such as access to health care, schools and education, conditions of work, leisure, homes, communities, towns or cities. In addition, good health also determined by their individual and cultural characteristics, such as social status, gender, age, ethnicity norms, values and discrimination. All of these factors influence an individual's chances of leading a healthy life. Chances for good health are not equally distributed in our societies, and this causes health inequities. Addressing these health inequities requires dealing with their root causes. To address health inequities that are deeply rooted in social determinants, concerted actions are required. This involves intersectoral coordination. It is an issue that was highlighted in the primary health care approach, and has been again revisited in the Commission's report. However, intersectoral coordination is easier said than done. An example of intersectoral collaboration is, the World Health Organization collaborate with the Child Health Division for Immunization Preventable Disease Program in Nepal. Next is, there should innovation in health care services. The first one is to have more offshore services. An example is teleradiology. It is a process in which X-rays are taken at one location, and then transmitted to doctors at another site. The second one is the integration of health information system. In some cases, a patient's chart in one hospital cannot be read by another hospital. The goal should be to create medical records that can travel with the patient. Now we'll talk about the uncovering inequity by World Health Organization. In Indonesia, 20 years ago, only 1 in 5 women in the poorest 20% of the population gave birth, with support from a skilled attendant. Through recognizing the inequalities and targeting programs towards the poorest populations, Indonesia has been able to improve the number of births attended by skilled personnel among the poorest population to 3 out of 5 births in the period 2007 to 2012. However, nearly all births among the richest 20% of the population were supported, to help countries like Indonesia to monitor health inequalities. WHO developed a new toolkit. It is called as the Health Equity Assessment Toolkit. It is a software package that utilizes data from the WHO Health Equity Monitor, and enables health professionals and researchers to explore the health inequalities in their countries. Additionally, users can compare the state of inequality in their country with other countries. Besides data on the proportion of births attended by skilled personnel, HEAT users can assess variations in coverage of immunization, antenatal care, contraception, breastfeeding. To name a few of the indicators covered, Malaysia is also taking a lot of effort to reduce the disparity of health between the rural and urban area. For example, Labuan will soon have ambulance boat for the emergency transfer of patients in dire need of medical treatment to the fully equipped government hospitals in the mainland of Sabah.